Hello, my name is Katrina Shaw. I am a student in the Occupational Therapy Assistant program at Washburn University in Topeka, Kansas. This presentation, part of my final fieldwork experience, is intended to provide education about lymphedema. This presentation will cover lymphedema, the lymphatic system, stages of lymphedema, risk factors, signs and symptoms, the diagnosis process, treatment options, management, insurance coverage, and the Lymphedema Treatment Act. Lymphedema is a chronic condition characterized by swelling in the body. Fluid accumulates near specific areas of the body in which there is damage or missing components of the lymphatic system. When the lymphatic system becomes overwhelmed, swelling may occur in one or both arms, one or both legs, the neck, face, and inside the mouth, the chest, or the genitals. Lymphedema is different from other types of swelling or edema caused by cardiac or kidney disorders because it is a condition resulting from a deficiency in the lymphatic system and only occurs in specific parts of the body. Lymphedema may be genetic or acquired. Primary lymphedema is a genetic condition and is subdivided into 3 categories based on the age in which it develops. Secondary lymphedema results from damage to tissues, blockage within the lymphatic system, or removal of lymphatic organs. 1 in 1,000 Americans have secondary lymphedema. The lymphatic system is an integral part of the immune system. Its responsibilities are to absorb, transport, and cleanse excess fluid in the body and maintain fluid levels in the blood and tissues. The organs of the lymphatic system are the lymphoid nodules, tonsils, lymph nodes, thymus, and spleen. The cells found in the lymphatic system are called lymphocytes. They monitor the body for pathogens, foreign substances, and excess materials. They create memory banks of antigens encountered and moderate the immune response. Lymphoid nodules are clusters of lymphatic tissue found in the digestive, respiratory, and urinary tracts. The largest of the lymphoid nodules, the tonsils, are found in the throat. They contain lymphocytes ready to defend the body from invaders. Lymph nodes are small clusters of lymphatic tissue found in the neck, chest, armpits, abdomen, groin, and behind the knees. Lymph nodes filter and clean lymphatic fluid before sending it on to the bloodstream. In childhood, the thymus produces specific types of lymphocytes. At puberty, it begins to shrink and becomes mostly fatty tissue as we age. The spleen is the largest organ in the lymphatic system. It filters blood the same way the lymph nodes filter lymphatic fluid. It removes abnormal blood cells, stores iron, and alerts lymphocytes when there is an antigen present. Lymphatic vessels can be found throughout the body, primarily near blood vessels. Capillaries, the smallest of these vessels, have thin walls with one-way openings that allow fluid, cell debris, bacteria, and viruses to enter without leaving. There are 2 layers of lymphatic vessels. Deep lymphatic vessels are found near deep arteries and veins that supply skeletal muscles and other organs of the neck, limbs, trunk, and walls of visceral organs. Superficial lymphatic vessels are found near the skin and in the digestive, respiratory, cardiac, urinary, and reproductive systems. Fluid in the lymphatic vessels is referred to as lymph. It contains oxygen, proteins, minerals, and nutrients that provide nourishment to tissues. It also hosts contaminants, damaged cells, including cancer cells if they're present, and foreign particles like bacteria and viruses to be filtered at the lymph nodes. Lymph travels one way through the lymphatic vessels and is cleansed at the lymph nodes. After filtering, lymph is brought back into the bloodstream at the subclavian veins, located just below the collarbone. Valves in the vessels maintain the directional flow and prevent fluid from flowing backwards. Skeletal muscle movement outside of the lymphatic vessels aids in fluid movement. There are 4 stages of lymphedema. The subclinical stage is considered the at-risk stage. It includes individuals who may have a damaged lymphatic system, like those that have experienced breast cancer or other trauma to the lymphatic system, and have no evidence of swelling. At the mild stage, swelling occurs, but often gets better with elevation. A dent, referred to as pitting edema, may be present when the skin is pressed, and the swollen tissue is soft to the touch. During the moderate stage, swelling becomes permanent. It does not respond to elevation. The skin and tissues thicken with increased volume and may feel hard to the touch. The severe stage is known as elephantiasis. A large deformed limb is present, tissue is hard to the touch, skin may be dry and discolored. Growths called papillomas may develop. When lymphedema is left untreated, it leads to progressive tissue swelling over time. This results in decreased wound healing and enables bacteria to grow, which increases the risk for tissue infections. Risk factors for lymphedema include radiation and chemotherapy, surgical removal of lymph tissue, vessels or nodes, biopsies of lymph tissues or nodes, tumors or malignancies of lymphatic tissue, infections, and obesity. Individuals with lymphedema may experience swelling in their extremities, swelling in the breast, chest, shoulder, pelvis, face, and/or in the mouth, reduced range of motion due to swelling at the joints, skin discoloration, pain or altered sensation, feeling like the extremity is heavy, and clothes feeling tighter than usual. For at-risk patients, doctors may diagnose lymphedema based on their medical history, symptoms, and a physical examination without the need for additional testing. It's important to rule out conditions with similar symptoms like cardiac or venous disorders, deep vein thrombosis, and other forms of edema. Non-invasive physical examinations include the Stemmer's sign, pitting edema, and measuring the affected areas. The Stemmer's sign is a test in which the skin on the top of the middle finger or the second toe is gently pinched. If the skin is unable to be pinched, this is considered a positive sign, meaning the patient is experiencing lymphedema. In the first 2 stages of lymphedema, the skin may still be pinched, therefore this test does not rule out lymphedema. To test for pitting edema, gentle pressure is applied to the swollen tissues using the finger. If a dent, or pit, remains when pressure is removed, this is a sign of pitting edema. Pitting edema is a symptom of liver disease and cardiac disorders. Therefore, the presence of pitting edema does not confirm a lymphedema diagnosis. Measurements may be taken by volume, circumference, or mechanically. Volume is tested by submerging the affected limb in water, then measuring the water displaced. Circumference is measured with a tape measure. Bioimpedance spectroscopy is a mechanical device used to measure fluid retention. Medical imaging, including CT, MRI, ultrasound, and lymphoscintigraphy, may be used. For lymphoscintigraphy, traceable liquid is injected into the lymphatic system and scanned. Images reveal blockages, damage, speed of flow, and function of lymphatic tissues. Because there is no cure for lymphedema, treatment focuses on management and varies based on patient needs, ability to comply with treatment, and the stage of lymphedema. Treating lymphedema in the early stages is critical to maintaining and managing the symptoms, as well as preventing progression. Treatments may include a combination of complex decongestive therapy, manual lymphatic drainage, compression bandaging, compression garments, pneumatic compression pumps, exercise, weight loss, drug therapy, skin care and wound management, and in rare cases, surgery. Complex decongestive therapy is also referred to as complete decongestive therapy or decongestive lymphedema therapy. CDT is a combination of treatments and the most widely used treatment option for lymphedema. There are 2 phases of treatment, reduction and maintenance. In the reduction phase of treatment, the focus is on reducing the swelling through manual lymphatic drainage massage, compression bandaging, exercise, and education. This phase can last anywhere from 3 to 8 weeks depending on results. In the maintenance phase, focus is on maintaining the level of swelling through self-management at home, performing manual lymphatic drainage massage, wearing compression garments, practicing safe skin care, and monitoring for changes in swelling and skin integrity. This phase is lifelong, and patients may need to return to their therapist if symptoms or swelling gets worse. Manual lymphatic drainage involves a sequenced light pressure massage completed by a trained and/or certified therapist. Therapists may obtain certification through the Lymphology Association of North America, or LANA. Certification is only available to RNs, licensed physicians, occupational therapy practitioners, physical therapy practitioners, certified athletic trainers, and licensed massage therapists. Manual lymphatic drainage was created by Emil Rotter in the 1930s in response to his own ill health. He believed that manual lymphatic drainage, in conjunction with purposeful breathing, exercise, and changes in diet, were the keys to managing lymphatic illness. Patients are often educated in an at-home form of manual lymphatic drainage as part of the self-management and maintenance phase of complex decongestive therapy. Compression bandaging is often used in conjunction with manual lymphatic drainage in a clinical setting. Therapists use short stretch bandages that resemble ACE bandages to wrap the affected limb with graded compression to encourage lymph to flow out of the affected limbs. During the reduction phase of complex decongestive therapy, compression bandaging is completed several times a week and bandages are worn 24 hours a day. Bandages are typically changed twice a week by the therapist. During the treatment sessions, the bandages are removed and the affected area is cleaned and inspected for skin irritations. As part of complex decongestive therapy, manual lymphatic drainage is performed and the affected area is wrapped again. Once swelling has been reduced to a manageable level, patients are fitted for compression garments. Garments help maintain swelling and should only be worn under the guidance of a trained therapist or physician. Details of garment care and wearing schedule is addressed by the therapist. However, garments are worn for a prescribed amount of time, sometimes up to 22 hours a day. Therapists may recommend purchasing 2 or more sets of garments so that a pair can be worn when the other is being washed. Garments should be replaced every 6 months to maintain elasticity. Surgery is often a last resort for lymphedema. In cases where conservative therapies have not worked to reduce swelling and pain, surgery may be suggested by your physician. Suction-assisted protein lipectomy, or SAPL, aims to remove the excess solids that have accumulated in chronic lymphedema. Lymphaticovenous anastomosis, or lymphovenous bypass, reroutes lymphatic vessels around damaged lymph nodes and connects them directly to veins to improve lymph flow. Vascularized lymph node transfer, VLN, or lymphovenous transplant, transplants healthy lymph nodes from one part of the body to the affected area. The Charles procedure is a skin grafting procedure. It was first developed in 1901 to address lymphedema. During the procedure, affected tissues are removed and the skin from a donor or another part of the body is used to repair the area. Companies like Tactile Medical and MediUSA have created an at-home solution to self-massage through the use of pneumatic compression pumps. Pneumatic compression pumps inflate and deflate to move lymph from affected areas in a sequenced pattern similar to manual lymphatic drainage. There are many ways to manage lymphedema. Low-impact activities like walking, swimming, and yoga are good for maintaining weight and range of motion. A lymphedema exercise program is a specialized routine provided by a lymphedema therapist. Muscle movement helps pump fluid. Proper diet helps to maintain a healthy weight. Compression garments should be worn according to the guidelines provided by the lymphedema therapist. Tight clothing may restrict lymphatic flow and cause further swelling. When traveling, wear compression garments, especially when flying or traveling to higher elevations, as decreased air pressure increases swelling. Sitting for long periods of time may increase swelling. Be sure to take special care of the skin. Avoid any injuries to the skin and areas where lymphedema is present. Injuries bring more fluid to the injured area and can become infected easily. Stay cool because heat can exacerbate swelling. Most private insurance companies cover complex decongestive therapy when it's deemed medically necessary, but they may not cover the cost of compression bandages. Some private insurance companies may cover the cost of compression garments and pneumatic compression pumps. Be sure to consult your insurance carrier or policy for specific details. Medicare may cover the cost of complex decongestive therapy, but it does not cover the cost of compression bandages. Medicare will not cover the cost of compression garments. If you have secondary insurance, they may cover compression garments, but you will need to get a Medicare denial first. Medicare will cover a pneumatic compression pump if the patient has undergone a 4-week trial of conservative therapy and the treating physician determines that there has been no significant improvement or if significant symptoms remain after the trial. The trial of conservative therapy must include use of appropriate compression bandage system or compression garments, exercise, and elevation of the limb. Funding assistance for garments may be available through the National Lymphedema Network or local charities. The Lymphedema Treatment Act is a federal bill that aims to improve insurance coverage for the medically necessary, doctor-prescribed compression supplies that are required as part of complex decongestive therapy. As of December 2019, the Lymphedema Treatment Act was passed in the House of Representatives as part of the House Drug Pricing Bill, H.R. 3. However, the bill has not been taken up by the Senate. Be sure to contact your senators or check out lymphedema-treatmentact.org for more details. If you think you may have lymphedema or have additional questions about your own personal symptoms, contact your oncologist or primary care physician. If you'd like more information about lymphedema, the National Cancer Institute's PDQ on lymphedema is informative and easy to read. That link is at cancer.gov and is listed here in the slide. The Lymphedema Treatment Act aims to improve coverage for individuals with lymphedema, and their website is lymphedema-treatmentact.org. The National Lymphedema Network has a mission to empower individuals with lymphedema and the practitioners who provide their care. Their website is lymphnet.org. Thank you for listening to my presentation on lymphedema.